A medical company from Australia recently revealed their pocket-sized HIV and malaria test gadgets to health practitioners in Johannesburg. This unique technology in a single compact unit can determine your health status within 15 minutes and boasts reduced errors. While these tests are designed with self-testing in mind, don't expect to pick one of these up at your local pharmacy anytime soon, as the test is currently intended for professional use only.
The feedback that we've received from people has been overwhelmingly positive, especially from the nurses and the practitioners in field that are using the product. When we originally designed the product, it was because we had perceived gaps in the market around the ease of use and the functionality of the test. Two of the negative feedbacks that we got when we were initially piloting the product was, the first one was that when we were testing people with thick skin on their fingers, so people that do manual labor, for example, get a bit of a calloused finger, we realized that the size of the lancet that we were using for the test wasn't big enough. So we needed to increase that size. So we've now got two variants of the test where we will use the normal lancet for people with thinner skin on their finger, and those people with thicker skin on their finger will use the larger lancet. And the second negative feedback that we got was around the diameter of the pipette when collecting the blood. And we knew that when we were testing people in cold conditions, that the blood didn't flow as easily as it should have. So then what we did was we went and increased the diameter of the blood collection pipette, and that then allowed for the blood to flow much more easily. The test at the moment is for professional use only. Obviously what we'd like to do is we'd like to get the technology simple enough and user-friendly enough where one day it will be able to be a self-test product. It's a simpler, more integrated test with less separate parts, and that leads to improved in-field performance and accuracy and less pressure being placed on the nurse to be able to perform the test competently, and we know that it results in better in-field performance. It's not the cheapest test in the market, but we know that the test is a high-quality test where the user gets good value, and that the reason why we priced the test for the time being in dollars is because we want to bring stability to our pricing, and we will pass on any strengthening of the rand. Any benefit of that will be passed on to the client. If the dollar strengthens and the rand weakens, then we will hold that price that we quote the client for 20 working days. At the moment we're looking at a number of options in potential for new products, one of those being hepatitis.